Hello, my name is Lori Powers, and today I am talking about late effects and how to code it using ICD-9-CM. What are late effects? Well, late effects are a condition or illness that develops because of or from another illness or injury. Now, there's no clear or set time frame that a late effect will develop. A late effect can show up within hours, days, weeks, months, and even many years after. Now, you have to read the patient chart carefully, as sometimes the way the doctors word things, you can miss the late effect, or you may think it's from a current illness or injury. When in doubt, research the illness or injury to see if it can cause a late effect and what late effects it can cause, and or query the physician for more specific information. Now, coding late effects requires two codes: the residual condition or nature of the late effect and the cause of the late effect. The residual condition of the late effect is sequenced first, and the cause of the late effect is sequenced second, unless the late effect is followed by a manifestation code. If the late effect has been expanded to the fourth and fifth digits, this includes the manifestation codes. Now, the code for acute phase of an illness and injury that led to the late effect is never used with a code for the cause of the late effect. Late effects are a condition or illness that develops because of or from an illness or injury. Now, late effects and the patient chart. Well, when a condition is a late effect of an injury or illness, it may be written in the diagnostic statement with terms such as late, old, due to an old injury, due to a previous illness or injury, following previous injury or illness, due to an injury or illness that occurred 1 year or more ago, traumatic unless there is evidence of a current injury, and then there is a term status post, abbreviated as P. Now, doctors will use this term to refer to an acute traumatic condition, as well as it is used to reference sequela of their cause. Now, here's some examples of late effects written in the patient chart, and I'm not going to go through all of these. There's another slide that I want to go through in a little more detail, and if I go through a lot of this, it will take up too much time. But I will pick out a couple of these just to kind of show you how they could be written in the patient chart. Let's see, cerebrovascular accident 2 years ago with residual hemiplegia of the dominant side. Bilateral neural deafness resulting from childhood measles 10 years ago. Neck pain resulting from whiplash. And then here at the very last one, I found one that uses status post, and it says the patient had neck pain status post a motor vehicle accident. Excuse me. When a cause of a late effect is not mentioned, then code only the late effect. When coding for a complication that is from a previous surgery, it's not coded as late effect. It would be coded as a history of a previous surgery, or it may be listed or coded for a complication of previous surgery. Now, remember that when a late effect code is taken out to the fourth and fifth digit, this includes the manifestation code. Just the cause of the late effect is coded. You would not add any additional late effect code when the late effect code is taken to the fourth and fifth digit. Do not do not use a late effect code for current injury or illness of the same type. The only exception to is category 438, late effects of cerebrovascular disease. If a patient comes in for a current or another late effect of cerebrovascular disease, you would code the late effect. Now, I found on supercoder.com, and I'm quoting directly from that article on the website, and it says, the ICD-9 manual includes a separate section 438.x that lists the late effects of cerebrovascular disease. These codes, such as 438.11, which is aphasia as late effect of cerebrovascular disease, describe both the residual condition and the cause. A late effect is a residual condition that a patient still has after the acute phase of an injury or illness has ended. Now, some examples of late effects from a CBA include speech deficits or paralysis. Now, in ICD-9-CM, there are 3 codes for late effects from a previous infection or parasitic infestation. An infection code is not assigned when the infection or parasite is no longer present. Remember to read the notes in your code books. These will tell you when not to code the late effect, as well as any restrictions, requirements, as well as if you need another code. Now, where can you find late effects? Well, you can find late effects by looking under the main term, late, and then the subterm, effects. Now, section 905 to 909 lists the late effects of injuries, poisonings, toxic effects, and other external causes, as well as you can find E-codes for late effects. And these are usually from an injury, such as an injury from a motor vehicle accident, a fall, something like that. Now here's an example that I put in to show you how we would code a late effect. Now this says traumatic arthritis, right ankle, following right ankle fracture. Now the late effect is sequenced, or the condition or nature of the late effect is sequenced first, which is 716.17, traumatic arthropathy, ankle and foot. Well, this was and then the late effect, which is 905.4, which is late effect of fracture of lower extremity. Whoop, that should have been first. You can also find late effect if you look under late effect and of. You can find these by looking for keywords, which is under the subterm effect. You can do due to, with, or of. Now, the E-codes that you can find as well, these are the main categories, and then of course you have the sub ones. And it's E929, E959, E969, E977, E989, or E999. Now remember, these have to do with an injury such as a motor vehicle accident, a fall, something like that. Now here's 3 methods for coding late effects. And I'm not going to go over this as it seems to be self-explanatory, as well as I want to go over the next slide as it has a nice flowchart that we can use. And I would like to kind of go through that one in more detail, so I'm just going to kind of skim this slide. Now the first one is the problem followed by cause. The code for late effects is followed by a manifestation. In cases where the code includes both the problem and the cause. Now here, categories to identify the cause of the late effects are 137, 138, 139, and so on. Now these codes can never be used as a principal diagnosis or as a medical reason for disability separation. They will always be used as an additional code when required. I found this helpful when coding late effects. I have put at the bottom of the slide where I found the information and with the web address. Now here I have a late effects diagnosis coding flowchart that I found online, and I thought it was a good idea to put this in my lecture. Now I think following both the 3 methods on the previous slide and this chart would help you to learn how to code late effects more efficiently and quickly. I also put the information where I found this chart and who the author is down at the bottom, and it should show up here in a minute. The first question to ask yourself would be, is the diagnosis a condition produced once the acute injury or illness is healed, sometimes called a residual deficit? If you said no, then you would not code the late effect. But if you said yes, then you would ask yourself, is the condition produced coded with a manifestation code? Now, if you said yes, then sequence the condition produced first, followed by the late effect. But if you said no, then you need to ask yourself, is the condition produced the result of a cerebrovascular accident or transient ischemic attack? Then ask yourself, is the condition produced coded with a manifestation code? If you said no, Sequence the condition produced first, followed by the late effect. But what if you said yes? Well, if you said yes, you would report 438 combination code that includes the condition produced and that late effect. Then ask yourself, does the 438 code require you to use additional codes? Now right here, this is when you really need to read your notes, because this is going to help you. Now, if you answered yes, sequence the 438 code first, followed by the code for the condition produced. But if you answered no, then you would use the 438 code to indicate each late effect of the CVA or the TIA. Now, always remember that you code the illness or injury that caused the late effect first, then the late effect, and then the manifestation code if it's required. And as I said, here is where at the bottom you'll see where I found this chart. You are more than welcome, I'm sure, to use this, or if nothing else, it'll give you an idea of one that you can create for yourself. Now, in summary, a late effect may be written in the diagnostic statement with these terms: late, old, due to an old injury, due to a previous illness or injury, following a previous injury or illness, due to an injury or illness that occurred 1 year or more ago, traumatic unless there is evidence of current injury or illness, and post status. When coding for a complication that's from a previous surgery, it's not coded as a late effect. The condition or nature of the late effect is sequenced first. The late effect code is sequenced second. When a cause of a late effect is not mentioned, then code only the late effect. Do not use the late effect code for a current injury or illness of the same type. An infection code is not assigned when the infection or parasite is no longer present. Then there is the 3 methods for coding late effects. Remember, problem followed by cause. The code for late effect is followed by manifestation code in cases where the code includes both the problem and the cause. You may have to look under the condition, illness, or injury to find the correct codes. Always refer to the official coding guidelines. They are crucial to coding. I suggest using the chart on the previous slide and see if this helps you code the late effect or create your own. Now this is everywhere that I found my information. If it doesn't have a link, I've used the Faye Brown ICD-9-CM textbook. Please let me know if you have any questions, and I will try to answer as best I can. Here's my email address. If I don't personally know the answer, I will find the answer for you and get back to you as soon as I have that answer. I want to thank you for listening to my presentation, and have a great day.